Have you ever wondered if the way that you're breathing could be contributing to your neck pain, your headaches, your dizziness, your fatigue, or even as to why running or walking suddenly feels harder than it used to? Most people never consider breathing as a possible cause. In fact, one of the most common things I hear as a respiratory physiotherapist is, "I never thought my breathing could have anything to do with this." Ask yourself, when was the last time you really thought about your breathing? Maybe during exercise, when you're trying to catch your breath. But my guess is probably not very often, unless you've been diagnosed with a condition like asthma or COPD. But breathing is so much more than that. Breathing is the foundation of everything that we do. Because it's something our bodies do automatically, it's easy to overlook just how much influence it has on our health, our movement, our ability to exercise, recover, respond to stress, and even how we experience pain. One important thing to understand is that breathing problems don't always mean that there's something wrong with your lungs. Many people have completely normal lungs and normal oxygen levels, yet still develop what's called a breathing pattern disorder. A breathing pattern disorder simply means the body has developed a less efficient way of breathing. Because breathing happens automatically, these changes often develop gradually. Over time, that inefficient breathing pattern can become your new normal, so it doesn't even occur to you that your breathing could be contributing to how you're feeling. When breathing becomes less efficient, the body may begin relying more on muscles of the neck, the shoulders, upper chest than it needs to. Over time, this can contribute to muscle tension, fatigue, and changes in how you move and tolerate activity. So let's talk about common symptoms. Most people don't come into the clinic thinking or saying, "I think my breathing is the problem." Instead, they'll tell me things like, "My neck or my upper back always feel tight," or "I can't get a satisfying breath in," or "I sigh or yawn a lot," or they tell me that they feel really fatigued suddenly, or their exercise, such as running, just suddenly feels a lot harder than it used to. Sometimes breathing is only one piece of the puzzle, but sometimes it's the missing piece that simply hasn't been explored yet. Breathing pattern disorders can develop for many different reasons. Sometimes they occur after a respiratory illness like the flu or COVID-19. Sometimes they're associated with asthma or other lung conditions. They can also develop following a concussion or other head injury, during periods of persistent pain, prolonged stress, or even after an injury that changes the way that your body moves. Often it's not one single event, but rather a combination of many different factors over time. One of the things I find most fascinating about breathing is that it's one of very few systems in our body that's both automatic and voluntary. We don't have to think about breathing for it to happen, but we do have conscious influence over it. That means breathing patterns can change, and importantly, they can often be retrained. During a respiratory physiotherapy assessment, I'm trying to understand how your body breathes, not simply how much air you can move. That includes looking at your breathing pattern, your respiratory rate, whether you're breathing through your nose or your mouth, how your rib cage and diaphragm are moving and working, whether your neck and shoulders are working harder than they should, how your breathing changes during walking, running, lifting, other exercise, and everyday activities. The goal is to understand why your symptoms are occurring, not simply teach breathing exercises. One of the biggest misconceptions is that respiratory physiotherapy is simply learning how to take slow, deep breaths. In reality, treatment is highly individualized. Depending on what's contributing to your symptoms, treatment may include improving nasal breathing, restoring rib mobility, improving diaphragm function, reducing unnecessary muscle tension, improving breathing efficiency during walking or running, helping runners coordinate their breathing with their stride, or integrating more efficient breathing strategies into work, lifting, or sport. Every person's breathing pattern is different, which means every treatment plan is going to be different as well. The goal isn't for you to think about your breathing all day long. The goal is for breathing to become effortless again, so you can focus on living your life and not managing your symptoms. Respiratory physiotherapy may be appropriate if you're living with asthma, COPD, persistent breathlessness, long COVID, recovering from a concussion, dealing with chronic pain, experiencing unexplained dizziness, or simply feeling like your breathing doesn't feel normal. Even athletes can benefit when breathing efficiency is limiting performance, recovery, or endurance. We breathe on average somewhere between 17,000 to 22,000 times every single day, and most of us never think about it. But when our breathing becomes less efficient, it can quietly influence how we move, exercise, recover, and feel. If you've been dealing with symptoms that never quite seem to make sense, whether that's unexplained breathlessness, persistent neck tension, dizziness, fatigue, or a decline in your exercise performance, your breathing may be one piece of the puzzle. It won't always be the entire answer, but sometimes it's the missing piece that simply hasn't been explored yet. If you're wondering whether your breathing could be contributing to the way that you're feeling, we'd be happy to help. To learn more or book an assessment, visit formphysiotherapy.com or contact our clinic at 604-708-4762, where our friendly front desk team would be happy to assist you. Thank you so much for watching, and we hope to see you soon at Form Physiotherapy.